Air. Hi, everyone, and a warm welcome to another episode of the Talk Room series of podcasts. I'm Wendy, and today we're diving into an incredibly important topic: seasonal affective disorder, or SAD for short. We will be looking at this and how you can be your best self, even when faced with this particular challenge, by leveraging the power of counselling and therapeutic support. For those of you who are joining us for the first time, I'd like to introduce my co-presenter, Ian. Ian is a senior accredited National Counselling and Psychotherapy Society member and the founder of Hope Therapy and Counselling Services. Hope is a counselling organisation offering support throughout the entire UK for many large, wide range of concerns and challenges, including couples counselling, which is another topic that we actually talk about. So a warm welcome to you, Ian.
Thank you, Wendy. That's really kind of you. Thank you very much. And let me return the favour by introducing you. Wendy is a highly experienced CBT psychotherapist who has been involved in the field of mental health and well-being for well over 30 years now. We're both absolutely passionate about helping people navigate their mental health, their relationships, and their well-being journeys. And today, it's a really important part of that.
Absolutely, and totally agree with that. So seasonal affective disorder, or SAD for short, it's a really important subject. We have discussed it before, but for those who haven't seen our previous podcast, Ian, could we start with me just asking you what exactly is seasonal affective disorder? Can you say a little bit more about it and help people understand what it is?
Yeah, a really great question, Wendy. So, seasonal affective disorder, often abbreviated to SAD, is a form of depression. It directly ties into the changing seasons. It's not just about feeling a little down when the days get shorter or the weather turns cold. This is a clinically recognized mood disorder that can have a really significant impact on somebody's daily life. SAD typically begins in the late autumn or maybe the early winter when daylight hours decrease and symptoms tend to lift as spring arrives and the days start to get a little longer. So that pattern is why it's sometimes referred to as winter depression. Although it's important to say that there is also a less common form called summer pattern SAD, which occurs during the warmer months as well. We'll talk a little bit more about that as we go along. So for most people with SAD, the seasonal shift triggers symptoms similar to those of major depression, that can include things like persistent sadness, low mood, a noticeable drop in our energy levels, difficulty concentrating on things, feelings of hopelessness or worthlessness, and even physical changes like oversleeping or overeating, often craving things like carbs, maybe gaining weight. And then, like a passing bad mood or the so-called winter blues, SAD symptoms are more severe and can interfere with daily functioning, can interfere with relationships and our general overall well-being. So it makes it really important to recognize it is a real medical condition that needs attention and needs support.
Mm. Thank you for that, Ian. That's really clear. Thank you. So, you mentioned a little bit about symptoms in that. I wonder if you could tell us something more about the symptoms, maybe to help people who are possibly struggling with it, or maybe a family or friend or someone who has it or is noticing it.
Okay, yeah, absolutely. So when we talk about seasonal affective disorder, SAD, um, The symptoms can vary from person to person, but they generally fall into two main categories in emotional and physical. So if we just start by talking about the emotional symptoms. So one of the signs of SAD is a persistent sadness, a feeling of deep, unshakable, low mood that can last for weeks or even months. It's not just a passing case of feeling down because the weather is gloomy. This is something that's more pervasive, and it can really have an impact on somebody's daily life. And many people can also report feelings of hopelessness, of worthlessness, which can make it difficult to stay positive, to stay motivated. And fatigue is another symptom people talk about. It's not just feeling tired, but a sense of overwhelming exhaustion, even after a full night's sleep. So people will often talk about a difficulty with concentrating as well. So people with SAD often describe their brain being in a fog, struggling to stay focused on tasks or making decisions. And then we have the more physical symptoms, which can be just as impactful. So one of the most noticeable things is a change in our sleep patterns. And lots of people with SAD experience hypersomnia, meaning they sleep much more than usual, but still wake up feeling very tired, very unrefreshed. And others might struggle with insomnia, finding it hard to fall asleep in the first place or to stay asleep once they have managed to go off to sleep. There are also changes in appetite for some people as well. And a lot of people with SAD have a real craving for carbohydrates. So think of bread and pasta and sweets, which often lead to weight gain during the winter months. And that craving isn't random. It's thought to be tied to the body's attempt to boost serotonin levels, which regulate or can help to regulate mood. Energy levels can also take a significant hit too for some people. Even simple daily activities like cooking or going for a walk can really feel overwhelming. And it's not about laziness. It's not about a lack of willpower. This is a genuine symptom of the condition. So these physical and emotional symptoms are closely linked, often creating a cycle where low energy feeds into sadness and sadness leads to further physical exhaustion. And together they start to paint a picture of a disorder that impacts not just how someone feels emotionally, but also how their body functions on a day-to-day basis. So recognizing those symptoms is the first step towards understanding that SAD isn't just a case of the winter blues. It's a real condition that can disrupt lives, and it's also treatable with the right support.
Okay. Okay, thank you. That's a really helpful answer. Thank you, Ian. And you gave a lot of detail about how people might recognize that they or a loved one could be struggling with the condition. And one of the things I find really interesting is the seasonal nature of SAD. Could you tell us a little bit more about that?
Yeah, and that's a really, really interesting thing. So so when we talk about seasonal affective disorder, SAD, it's important to understand that there are two main types of the condition, as I mentioned earlier. So based on the time of year when the symptoms emerge. So we have winter pattern SAD and summer pattern SAD. So we'll start by talking a little bit about the more common and the better known winter pattern SAD. And for most people with SAD, the symptoms begin, as I mentioned before, round about late autumn, maybe the early winter. As the days start to get shorter, the weather turns a little bit colder, and the lack of sunlight combined with the shorter daylight hours is believed to trigger changes in the brain that can affect mood regulation. So for some, this results in a period of depression, of low energy, of irritability, and the physical symptoms we talked about earlier as well. So that excessive sleep, that overeating, especially for carbs. And winter pattern SAD tends to lift as the days start to get longer in the spring, and symptoms often subside as people get more exposure to sunlight. So that cyclical pattern is what sets it apart from other forms of depression. It's clearly tied into the seasons. And then we have the less common, but still very significant summer pattern SAD. And this type of SAD typically occurs during the warmer months, usually in the late spring or the summer, when there's actually more sunlight. So, and whilst it may seem counterintuitive, some people experience depression, irritability, insomnia, and a lack of appetite during that particular period. And in fact, people with summer pattern SAD may have trouble sleeping due to the long days, which can disrupt their body's natural circadian rhythms. And there are various symptoms of summer pattern SAD, and that might involve things like increased anxiety, a loss of interest in activities that would normally have brought us pleasure or joy, and a general sense of unease, a general sense of restlessness. So this form of SAD, much less understood, much less common, but it can still be incredibly distressing for those who experience it. And we think that the differences between these two patterns primarily come down to the way that sunlight affects the body's biological processes, like melatonin and serotonin production, those types of things. And it's thought that in the winter, less light causes lower serotonin levels and changes in the circadian rhythms, which can lead to feelings of depression, whereas in the summer, longer days and excessive sunlight is thought to have the opposite effect, so disrupting sleep, potentially leading to mood swings and irritability. So for both types of SAD, the condition is often cyclical, meaning that the symptoms follow what we might think of as being a predictable seasonal pattern. And treatments are tailored to the specific time of year. And that's why recognizing whether you have winter pattern or summer pattern SAD can help you to choose the most effective approach to managing the condition.
Okay, thank you for that, Ian. A really interesting and thorough answer, Ian. So, so it's really interesting. So now that we understand what seasonal affective disorder is and why it happens, are we able to take a closer look, for instance, to who is at most at risk for developing this condition?
Yeah, and that's a really, really good question. And whilst anyone can experience SAD, according to some research studies, there are certain groups of people who are more likely to be affected. So some research studies suggest that women are more likely to develop SAD than men. In fact, studies have shown that women are diagnosed with SAD at a rate of between 60 and 90% more often than men. And there are various theories about why that happens, why that might be the case. And one possible theory being that women are more more sensitive to changes in light of hormones. And it's also thought that hormonal fluctuations during different stages of life, so during menstruation, pregnancy, menopause, could make women more vulnerable to mood disorders, including things like SAD. Younger adults as well, more likely to be affected by SAD, particularly people between about 18 and 30. And while SAD can affect people of all ages, younger people tend to experience more severe symptoms and are diagnosed at a higher rate. And again, it's believed that younger people may be more prone to the emotional and the social isolation that can come with SAD, as well as the physical symptoms like fatigue, disrupted sleep patterns, which can just have a greater impact on life, on work, on school, on social lives. Also, people with a family history of mood disorders, such as depression, such as bipolar disorder, may place you at a higher risk of developing SAD as well. So some research seems to show that people with close relatives who've struggled with depression or other mental health conditions are more likely to experience mood disorders. And those things could be due to genetic factors, or it could be to do with shared environmental factors that can just increase our vulnerability. So there's an interplay between genetics and environmental triggers, like seasonal changes, that just make people with a family history of mood disorder more susceptible to SAD.
Okay, thank you very much, Ian. Again, a very thorough explanation. So, what should people do if they think they have SAD?
Yeah, and again, a really good question. It can be tough to differentiate between SAD and general winter fatigue or a temporary slump in our mood. But the key is recognizing when your symptoms go beyond just the winter blues. So if you notice that persistent feeling of sadness, that low energy, that trouble with concentrating, changes in your sleep, in your appetite that's impacting daily life, it's important to take those signs seriously. And if you notice those things, and you think you might have SAD, there are various things that people might consider. And the first is just talking to a professional. That might be a therapist, that might be a counselor, that might be a doctor. And it is really important to talk to someone who can help you to assess your symptoms. So mental health professionals are often trained to recognize the signs of SAD, and they can just help you to determine what you're experiencing. Is it linked to seasonal changes, or if something else, or is something else at play? And they can also help you to rule out other potential causes for your symptoms as well. So there might be general depression or medical conditions that might affect mood or energy levels. They might ask you about your mood, your sleep habits, overall well-being during the autumn and winter months, to see if there's a pattern to help you to understand what's going on. And what I would always say is, don't hesitate to share the details of how you're feeling. Even if it's hard, it can be hard to articulate these things if we're not used to doing it. But it's really important to be as open as we can be, and just to give you the best possible support. And then there are various treatment options that might be suggested to you. So one might be things like light therapy, and one of the most common treatments that's often used. And that's just about sitting for maybe 20 to 30 minutes a day in front of a special light box. It helps to regulate the body's circadian rhythms, boost serotonin levels by mimicking natural sunlight. So for some people, light therapy is particularly helpful for those people who have the winter the winter pattern SAD. And then there are different therapeutic approaches. The one that lots of people have heard of is cognitive behavioral therapy. That's your area of specialism, Wendy. So CBT, and that's been shown to be effective for many people with SAD. And CBT helps you to identify and change negative thought patterns, which can help to improve your mood. It can help you manage the symptoms of depression. And sometimes if you go and see your doctor, they might talk to you about medication as a possible option as well. And they might recommend things like antidepressant medication to you. So selective serotonin reuptake inhibitors, SSRIs, are the most common ones that tend to get prescribed for people struggling with SAD, as it can help to regulate serotonin levels in the brain. And medication might be an option if the symptoms are severe or if therapy alone doesn't provide enough release for you. So that's a conversation to have with your doctor potentially. And then there are different lifestyle changes. So what can be really simple lifestyle changes, such as increasing physical activity, getting more exposure to natural sunlight, maintaining a regular sleep schedule to the extent that that's possible. Those things can make a big difference to some people. And what I would always say is just consider self-care strategies alongside any other support that you might be receiving. So just things like getting outside as much as possible, even if it's cloudy. That natural daylight, even in small doses, can have a significant positive impact on some people's moods and some people's energy levels more generally as well. Socializing with loved ones, with family, with friends, spending time can just help to combat that feeling of isolation, which can be really quite common with people with SAD. We may not feel like doing it, but often just embracing it to the extent that we feel able to, just pushing a little bit, can have positive effects for some people. And then there are various different relaxation techniques, such as mindfulness or yoga or meditation, which can help to manage things like the stress levels. And again, for some people, that can help to improve mood as well. We might consider things like keeping a mood journal, so just tracking our symptoms. So by writing down how you feel every day, you can potentially start to spot patterns, identify triggers that might worsen your symptoms. And that information can be really, really helpful when you're talking to your doctor or your counselor or your therapist, when you're talking about different options, different treatment options. So those would be the sorts of things I'd be suggesting.
Mm. Okay, thank you, Ian. That's a really another very helpful answer. So thank you so much for that. So my next question is, you did mention counselling, and I wonder whether you could say a little bit more about how counselling or therapy can help.
Yeah, absolutely. So, therapy or counselling can be an incredibly helpful tool for some people when it comes to managing and treating seasonal affective disorder, SAD. And whilst medication and lifestyle changes like light therapy or exercise can often be part of the treatment plan that you receive from your doctor, therapy often just offers a supportive, non-medication based approach that can just address the emotional and the more psychological aspects of SAD. And we mentioned CBT, cognitive behavioral therapy, and CBT is one of the most evidence-based forms of therapy for depression more generally, but certainly for SAD. Um, uh, and that type of therapy focuses on identifying and challenging and changing negative thought patterns and behaviors that can contribute to the feelings of depression and low mood. So when it comes to SAD, people often experience negative thinking patterns that are tied to the lack of sunlight and the cold and the dark months. So, for example, someone with SAD might say that they feel like they're stuck in a never-ending winter where their mood will never improve, or they may develop an overwhelming sense of hopelessness about the months ahead. And CBT can just help to reframe some of those things, some of those thoughts that we may have. It can just start to begin to help us to see that their feelings of sadness and their isolation are temporary, and therefore start to become a little bit more manageable for people. And in CBT, therapists help clients just to break down some of the overwhelming thoughts into smaller, more manageable ones. So, for instance, a person um, might feel hopeless about getting through the winter, but with CBT, the therapist can just help them to recognize that there are specific actions, like light therapy, getting outside more, connecting with others, that could just make a difference for many people in terms of how they feel. And often, over time, clients can just learn how to adjust their thinking and start to adjust their behavior a little bit to be able to better cope with changes in the season. And then there's what's called behavioral activation, and this is an important part of the CBT model, the CBT approach to working therapeutically with people. And it's a technique that just encourages people to re-engage with activities that typically they enjoy but may have withdrawn from due to their symptoms. So people with SAD often feel they're exhausted, they're disinterested, they feel unmotivated to do the things they normally love. They might withdraw socially, they might stop exercising, they might skip a hobby that once they really, really enjoyed, that can just perpetuate feelings of isolation and lead to a worsening of the depression. So people, if they're working with CBT and other models as well, can just help to guide people to gradually start to reintroduce some of those activities into their day-to-day life again, even if it feels really hard. So those things don't have to be big either. They can start with something as simple as taking a short walk, calling a friend. So the goal is to just help people experience the positive effects of doing things they enjoy, which in turn can just help to improve mood and start to improve energy levels. Also, another therapeutic approach which many people find helpful is what we might describe as mindfulness-based therapies. And that type of therapeutic approach can help to teach people how to stay present in the moment and manage negative emotions as best they can without judgment. So when people are dealing with SAD, it's easy to get caught up in worries about the future, the long months of winter, the holidays, or how much harder things might get. And mindfulness just helps to shift the focus away from worrying about what they think is going to come, and instead helping people just to practice self-compassion, practice awareness in the present moment. And by learning how to accept and observe their emotions without becoming completely overwhelmed by them, people with SAD can often reduce the intensity of their symptoms and just feel more in control in terms of their emotional responses. And therapists can often help just with practical strategies is well to deal with the physical symptoms of SAD. So, for example, they may talk to clients about how do we create a structured routine that includes regular sleep patterns or regular exercise, healthy eating, getting outside and using whatever sun is available to us, getting into a routine that just helps combat the lethargy, the disorganization that can often accompany SAD. And it can also provide a sense of structure, a sense of stability, which can be really, really important when everything else might feel out of balance due to the changing seasons that are going on around you. Also, therapy can just help you to set realistic goals. So people with SAD may often feel quite overwhelmed. So having a therapist just breaking things down into really, really small, bite-sized, achievable steps can just make it feel easier to accomplish something. So, for example, instead of setting a broad goal like I want to feel better, a therapist might help people with a more manageable goal, such as I'm going to go out for 15 minutes every day, or I'm going to schedule a catch up with a friend. So smaller, more manageable tasks rather than that really huge thing of I'm going to feel better. And then just more generally looking at enhancing coping skills, enhancing resiliency, just to better manage the emotional toll that SAD may be having on us. People who experience SAD may feel a lack of control over their emotions when winter comes. And therapy can just help them to regain some sense of control by teaching coping skills and strategies and techniques, such as looking at relaxation exercises, looking at stress management, looking at problem solving skills. Just building resilience can, for many people, be a really important element of getting through not only the winter months, but also life's challenges in general. So with the right tools in place, people can just start to navigate difficult emotions and difficult circumstances in healthier and more effective ways. And that can make therapy a really important long-term strategy for both managing SAD in the present, but also preventing it from becoming an overwhelming feature year after year after year. And then maybe the final thing in answer to that question is just counseling or therapy can just provide a safe, supportive environment where people can express their feelings, and knowing that they're doing it without fear, knowing that they're doing it without judgment. And sometimes people with SAD, they can feel all sorts of secondary emotions. They can feel guilt, they can feel shame about how they're feeling, and maybe how they perceive what they're feeling, the impact that it may be having on other people. So working with a counselor, working with a therapist, just to talk about those emotions can make a world of difference to some people. It can just allow people to feel heard, to feel validated, to feel supported in their struggles, which can be an incredibly healing part of the overall process.
Mm-hmm. Yes, again, really interesting, Ian. Thank you so much for those explanations. They're very, very good and very in depth. So thank you for that. So I'm wondering, Ian, if someone has listened to this podcast and feels they might benefit from professional help, what should they do next?
Yeah, so thank you for that, Wendy. So there are organisations out there, such as Hope Therapy and Counselling Services. We, for example, have we have a large team, very experienced counsellors and therapists who work with all sorts of forms of depression, including SAD that we've been talking about today. People are very welcome to look us up. Our website is www.hopefulminds.co.uk. That's www.hopefulminds.co.uk. We work throughout the country, and we have a whole variety of different free resources. We give really detailed information about a whole range of different services. We also offer free consultations with people where they can just talk to us in a really unpressurized way about what they're going through, and we can talk a little bit about what is on offer as well. And you, Wendy, as a hugely experienced CBT therapist who works with SAD and other forms of depression as well, maybe you can just talk a little bit about you and what you have to offer as well.
Yes, certainly, Ian. So my website is my name, which is wendycastellino.com. And if anybody's interested in any therapy around depression or SAD or any other mental health issues, they're very welcome to get in touch with me and have a conversation. And again, there's lots of downloadable worksheets to help with all kinds of problems and conditions. So thank you. Thank you so much, Ian, for that very comprehensive understanding of this condition, which is very common at the moment, SAD. So thank you so much for giving all your information. And thank all the listeners for taking the time and trouble to listen to this podcast today. Thank you very much.
Thank you, Wendy,